President Joe Biden tested positive for COVID a second time, just days after recovering from his first case.
Hey folks, Joe Biden here. Tested positive this morning. Going to be working from home for the next couple of days. And I'm feeling fine. Everything's good. But Command and I got a little work to do.
Keeping the dog there to keep him company. The president's diagnosis is raising a lot of questions about testing positive again so quickly. Abby Liocco verifies over the course of the pandemic about this.
Over the course of the pandemic, we've learned not only can you get COVID-19 more than once, these positive tests can happen quickly. And now we're seeing the same infection can even rebound and make you sick all over again.
Even if you're kind of tired of this, the virus is not tired of us.
That's Dr. Stuart Ray with Johns Hopkins. We talked to him, consulted the CDC and FDA guidance, and checked in with Pfizer and the White House COVID-19 response team to verify. What do we know about COVID-19 rebound cases?
This is a pattern we're seeing that people will report that they recently had COVID and now they're sick again.
This CDC health advisory defines COVID-19 rebounds as a recurrence of symptoms or a new positive test after having tested negative, happening 2 to 8 days after initially recovering from the virus.
The virus may be sort of evolving in that person, or it might just simply be replicating in that person for a while, and then it gets the upper hand, at least for a while, and causes a rebound.
It's like a zombie type of thing where it comes back to life within them in some ways.
That's right. And the distinction is it's never dead.
This happens in 2 to 8% of COVID cases, according to the White House. In a July 21st press briefing, Dr. Ashish Jha says all the data he's seen shows it's, quote, not that common. President Biden's rebound case happened after treatment with Paxlovid, an antiviral authorized to treat COVID-19 symptoms. In its official guidance to healthcare providers, the FDA points to the drug's clinical trial, in which the number of rebound cases is the same in people treated with Paxlovid as those who received a placebo, less than 2%.
I think the rebound may happen intrinsically by the virus simply coming back up again, and that's seen with or without antiviral treatment.
That's why the CDC continues to recommend Paxlovid for COVID-19 patients at high risk for getting severely sick. And the guidance remains isolate after a positive COVID-19 test, even a rebound. Though at this time, the CDC says all of these cases have been mild, and it's not recommended someone get another round of antiviral treatment.
Variants and now subvariants are the driving force of new COVID cases this summer. Experts say President Biden likely contracted the BA.5 Omicron subvariant, one of the most contagious so far. It, along with the BA.4, accounts for more than 90% of recent cases in the U.S. Now, health officials and vaccine managers are working on the next generation of vaccines.
The vaccines we have are terrific, but we can do better than terrific.
Vaccine boosters that are more targeted to the Omicron subvariants could be available sometime this fall.
It's what we would call, say, a universal coronavirus vaccine. So it's trying to target a part of the virus that doesn't mutate as much. Figuring out what that is and still getting a vaccine that creates a good immune response that protects you is a little bit of a challenge, and it is going to require more resources.
At a vaccine summit just last week, government and industry experts pushed to continue partnering to develop more accessible vaccines that could eventually cause little to no side effects, and using delivery methods beyond needles like a nasal spray.